Hello, my name is Erica Guhar. In this video, I will be demonstrating a systematic assessment and corrective exercise strategy for knee valgus, which is when the knees collapse inward during a movement. I will be utilizing the NASM corrective exercise continuum, which is where we will be inhibiting, lengthening, activating, and integrating different movements to help correct this issue.
We did an overhead squat assessment, and as you can see, my client demonstrated bilateral knee valgus with the knees moving inward during the descent phase. Notice how the knees move medially over the feet rather than tracking and land with the toes. This movement pattern indicates specific muscle imbalances. Based on this assessment, we can see the overactive muscles are the adductor complex and the TFL and IT band, pulling the femur into internal rotation and the knee into valgus position. Underactive muscles are the gluteus medius and vastus medialis as they fail to maintain proper knee alignment and hip stability. We also did a gait assessment where we noticed increased pronation at the subtalar joint coupled with internal rotation of the tibia and femur.
This knee valgus pattern is likely due to several factors, with the TFL and the adductors creating internal rotation of the femur, as well as tightness in the lateral gastrocnemius can lead to the foot pronating and decreasing ankle dorsiflexion. Combined with weakness in the hip abductors, particularly the gluteus medius, these factors create a mechanical disadvantage where the knees are falling inward during weight-bearing activities like a squat. These muscle imbalances significantly increase the risk for injury, particularly ACL tears, patellofemoral pain syndrome, and IT band syndrome as well.
First, we will begin with inhibitory techniques to reduce hypertonicity in the overactive TFL and IT band, as well as the lateral gastrocnemius. I am demonstrating foam rolling on the lateral thigh region. The client will position the foam roller under the TFL area and slowly roll. Pausing on tender spots for 30 seconds, perform 1 to 2 sets of 60 to 90 seconds per side, focusing on 3 to 5 tender spots for about 30 seconds each. Next, we are foam rolling the lateral gastrocnemius. You want to position the foam roller under the outer portion of the calf muscle and slowly roll from just below the knee to above the ankle, pausing on tender spots for about 30 seconds. You want to perform 1 to 2 sets of 60 seconds per side. This inhibitory work should be done daily, especially before workouts or stretching sessions. This technique helps reduce neural drive to the overactive muscles by stimulating the Golgi tendon organs, creating autogenic inhibition. This helps decrease hypertonicity before we move to stretching, making the lengthening phase more effective. Next, we are lengthening the TFL using this standing stretch. The client will cross the leg behind, making sure to keep the pelvis level, and push the hip outward while keeping the spine neutral. This creates a stretch along the lateral hip and thigh. For the lateral gastroc stretch, the client will face a wall with the affected leg behind them, keeping that leg straight with the heel down and foot slightly turned inward to target the lateral portion of the calf. They'll lean forward, maintaining a straight back leg, feeling the stretch in the outer calf. You will perform 2 to 3 sets of 30-second holds per side for both stretches without bouncing, breathing deeply throughout. For optimal results, you want to incorporate this stretch 1 to 2 times daily. Now we will activate the underactive anterior and posterior tibialis muscles to improve ankle stability and counteract the effects of an overactive lateral gastrocnemius. For both muscles, we'll use a seated cable dorsiflexion exercise. The client will sit facing the cable machine with an ankle strap attached to the low pulley. For the anterior tibialis, they'll pull the foot upward against the resistance, focusing on dorsiflexion while maintaining a neutral foot position. For posterior tibialis, using the same cable setup, they'll perform dorsiflexion with inversion, pulling the foot upward and slightly inward against resistance, which specifically targets this deeper muscle. You will perform 2 to 3 sets of 10 to 15 reps per side with a 2-second isometric hold at the top position and a 4-second eccentric contraction. You will rest 60 seconds between sets. These exercises should be done about 3 to 4 times per week as part of your regular strength training routine. We will integrate these improved muscle firing patterns with dynamic cutting maneuvers. The client will start in an athletic position at the top of a plyo box. They'll step off the box, absorb the landing with proper mechanics, then immediately perform an explosive lateral cut to one side. During this movement, focus on maintaining proper knee tracking and land with the toes, preventing any medial knee displacement. while keeping stable ankle positioning without excessive pronation. We'll start with 2 sets of 10 to 15 repetitions under control per side with 90 seconds rest between sets. As control improves, you can progress to 3 sets of these repetitions. You'll perform this exercise 2 to 3 times per week after completing the previous corrective exercises.
This systematic approach using the NASM corrective exercise continuum addresses knee valgus by first inhibiting and lengthening the overactive TFL and IT bands and lateral gastrocnemius to reduce compensatory forces, then activating key stabilizers like the gluteus medius and the tibialis muscles to restore proper alignment, and finally integrating these improvements into functional exercise movement patterns. This evidence-based sequence optimizes neuromuscular reprogramming by addressing both mechanical restrictions and motor control deficits, creating lasting improvements in knee mechanics that significantly reduce injury risk when performed consistently.